Andreas Münzer, amazing bodybuilder, died March 14th, 1996. He was only 31 years old. This is definitely old news, but his case and the cause of death and the situation around this amazing man continues today. So I'd like to bring this to you in part because it's just an amazing story. And he was born October 25th, 1964. Today is October 1st, 2021. I just turned 57 years old. If Andreas was alive, he would be enjoying his 57th birthday in just a few weeks. This means so much to me, guys. So let's break this down for you as I do, so passionately, as I love so much. So here I am in this hotel, the southernmost house, guys, in Key West. Doing it straight from Key West for you guys. It's so important for me to get this information out to you. So let's really put the thinking caps on, guys, because I did a lot of research. It's not just that he died from steroids in the hospital. What happened? Let's really get into what happened. In the end, I'm going to run through the autopsy report, pathology, professional report. Let's go back to the beginning. Who was this guy, Andreas Münzer? He was a very, very quiet and humble and super hardworking bodybuilder. Super shredded beyond belief. Supposedly, he's the guy that they said had zero body fat. But guys, you know that no one can truly have zero body fat, but whoo-hoo, look at the pictures of this guy. He was certainly down to the single digits, and he lived there for probably almost year-round sometimes, and is that part of what happened? Follow me, guys, on this. So, in competition, he's 5'9", he's 240 pounds, 21-inch arms, on stage, or close to these numbers, right, guys? And he competed for at least more than 10 years or greater, with many, many bodybuilding shows. So these are some of the details, guys, that unlike some of the pros today that know to be careful not to stay in pre-contest prep with those drugs and that lifestyle, not to mention the dieting that's required for too long. So see how amazing that is. When I did my deep research on this guy, found out that he competed in a lot of shows. Before he died, he did his last Arnold Classic, and then he did another show. And then he flew back to Germany subsequently, where he died. Got off the plane, he was sick. He was suffering. So let's talk about his drug regimen, guys. Let's go right into this guy's lifestyle and the drug regimen. Hey guys, quick pause here. If you're watching this video, odds are you're concerned about your testosterone levels. That's where the sponsor of this video comes in. Let'sGetChecked.com. Let's Get Checked makes professional health testing easy by letting you get tested without having to visit a healthcare provider. Choose your test online, like one of their testosterone panels, and it will be delivered to you in discreet packaging with next day delivery. Once your sample arrives in a laboratory, confidential results will be available from your secure online account within 2 to 5 days. See my link in the description for more details and discount code. Guys, let's go right into this guy's lifestyle and the drug regimen. And I never am ever here to pass judgment or criticize, because this poor man, post-death, received so much bad press in Austria, where he's from. He's a native brother of Arnold. I mean, he's from the same country as Arnold Schwarzenegger, and they knew each other. So the drug regimen was very interesting. He was known to live on a lot of contest prep regimens for prolonged periods. Boom, there it is. That's why he died, really. But let me break it down further. He lived on hydrophilic-based, water-based, non-aromatizing drugs. Listen to that, guys. When you read about what he took and how he lived, of course he did testosterone, straight up testosterone, esters, cypionate and nanthate, Succinate 250, right in Europe. Been around since the 1970s. But he lived on that. But you know, guys, when bodybuilders go to competitions, and I am certainly no professional diet guru guy, but we all know, or it's known, that they shift over to drugs like winstrol. These are high hydrophilic water-based drugs that are very incredible for making super lean, hard bodies with very minimal to zero aromatization. Also drugs like parabolin, that's tren, equipoise, masteron, primobolan, anavar, which is an oral steroid that everyone knows can possibly be safe if limited. That's the key word. He also is known to be on growth hormone, IGF-1, which, can you really get IGF-1, especially back in the 90s? I don't know. That's a question. I want comments. And insulin. And that was new, right? So in the 70s and 80s, insulin, I know some guys might have used it, but the 90s, guys, the 90s, that's where the insulin comes into play. But look at his gut. Did he have the IGF calorie-based insulin gut? No, no way. So how much did he use of insulin in GH? I don't know. He also was known to use thyroid preparations, Cytomel, T4, combinations, armor, all this stuff, and diuretics. He was known to use diuretics extensively. Look at the shredded physique. Again, remember, he's doing this and he's living chronically in the pre-contest prep stage. Now, when I did the research on this, they talked about potassium sparing diuretics. Now, this is 2021. We see deaths in the community. It appears more from women, and it's definitely in part related to the diuretic use. Let's keep going. His death, this man's death, occurred after a bodybuilding show. He had stomach pain, documented for months, weeks, stomach pain. Maybe he had a gastric ulcer. Apparently he had some type of gastric or small bowel ulcer chronically. That has nothing to do with steroids per se itself. People have this. Let's keep going. Now let's look at the medical examiner's pathologic report, the autopsy report from a pathologist in Germany. His heart was enlarged, no question. 631 grams, normal heart, 300, 350, around this. So kind of double-sized heart. Guys, that's all the left ventricle. It's all the left ventricle hypertrophy. This hypertrophies, so does the heart. I want you guys to understand this. You know, is that secondary to utilization of contest prep drugs and causing death? No, just had a super enlarged heart. He's training hard, taking calories, taking anabolic and androgenic agents on top of insulin and the growth. Okay, so the heart enlarges. We see it. We see it today. Did it lead to his acute cause of death? We don't know. Next, liver, 2.8 kilos, 2,871 grams. Normal liver is up to about 2,000. So, unlike some of the other guys, unfortunately, like Dallas McCarver's autopsy, you can see that his liver was enlarged. So, kind of organomegaly, right? So you got the heart's enlarging, that's for sure. The liver's enlarged. Now, on the pathology report, they spec'd out numerous table tennis size tumors, very small, small, but not for the liver. So he had all this type of cysts. These are liver cysts that are very classic with oral steroids, not injectable, but oral steroids. Liver cysts, they call them tumors, but they're not malignant tumors. usually, very rarely, they're blood-filled cysts. And they're dystrophic though. So dystrophic means it's just diseased and non-functional. But it's interesting, was he jaundiced? Was he walking around jaundiced? Did this stuff happen overnight? Answer is no. How do you live like that? But he certainly presented to the hospital with gastrointestinal pain, and that's what he presented with, supposedly. And how would you live like that? Was he walking around yellow and jaundiced? He just did bodybuilding shows. I want you guys to really think about this as we sequentially go through it. Next, kidneys. It just says severe nephropathy. So we all know that the type of kidney disease that's associated with anabolic steroid use chronically that gets diseased is FSGS, focal segmental glomerulosclerosis. So you see what's happening now, guys? The organs are taking the hit, there's no question. He's on the gas with the drugs for just more than 10 years. It's amazing how much the body can take. And then we're going to talk about, he hits the moons line up and he hits his over-under. So the testicles are also stated to be atrophied significantly to the point where they're the size of hazelnuts. They said hazelnut-sized testicles. Now, this is kind of a secondary thing because we know that men use steroids, even testosterone, for TRT. Your testicles are going to shut down. Your brain is exposed to androgen. Hypothalamus pituitary gonad axis goes to sleep. Testicles shut down. They don't produce testosterone. When you're on, can they come back? This is all a question. PCT, does it work? Does it not? All questions, all individual for you guys. So, but the testicles shrink down and they go to sleep and they become dysfunctional, so they're not producing endogenous natural testosterone and they're certainly not producing semen. So it's a birth control device. I do this all day long for you guys. I love doing this. It's my patients. Some of you are my patients. So when you look at that, that wasn't a cause of death. That was just a statement in part. And when they autopsy a body, they really go from head to toe. So they didn't talk about anything else, at least the things that I found online regarding the cause of death that the medical examiner felt was necessary, or whoever put this on the internet feels it's necessary, because they look at a lot of other things. They look at the thyroid, they look at the lungs, the brain, everything. So these are the salient points. So what happened? What happened to him, and what was the cause of death stated legally? Dystrophic multi-organ failure related to heavy steroid use. That's it. That's what they say. And then that went around the circles in Europe and in the world, and he died at 31 years of age. Now, let's evaluate this. So, as I said, 10 years of steroid use. This, we have to be very clear, there's no known genetic underlying problem with this guy. When you look at some of the other reports I've read and some of the other causes of death, where you break it down, it gets very, very, very complicated, like John Meadows. Is there an underlying genetic mechanism or propensity that when you put it on steroids, it's accelerated? That's why I want you guys to really know what you're made up of with your family history and your heart, if you have plaque in the arteries, before or during the steroid use. And I want young men to never do steroids. I'm begging you to consider an alternative route. Otherwise, you're going to end up potentially like me and millions and tens of millions of men that were living on testosterone. And it may not be that bad. But if you're 18, 19, 21, 31, do you know that if you go on testosterone and you do enough of it, even not like this, you're going to end up on testosterone for life, and maybe you're going to have hazelnut-sized testicles like me. Sex is great. I'm infertile. 57. Today's my birthday. Thank you. Let's keep going with this stuff for you guys. So because of his heavy competition frequency, think about this, guys. I think this is it. I think I put this together for you guys for this. Because so many guys do steroids. This is 1996. I mean, this is so long ago. Steroid use has actually probably increased more, for the monsters and certainly the growth and the insulin. But he died. Did he have underlying disease? I don't know. Probably not, actually. It's dystrophic multi-system organ failure related to steroids. That's a global term. But here's what I think happened. He's on pre-contest preps for so long. He's bouncing from contest to contest. I think you guys are in agree with me on this. Let's get comments. He's under that stress with the orals, with the water-based drugs to stay so lean, have no estrogenic effects at all, and he's just super tight, and he's just cranking orals, cranking the intermuscular hydrophilic water-based winstrol. He's known to love that, and that makes you rip to shreds. So, and then he has peptic ulcer disease. Now, there's no relationship directly between anabolic steroid use and peptic ulcer disease. There is none, but he had peptic ulcer disease. Maybe he was very stressed. Maybe he took a lot of non-steroidal anti-inflammatory drugs. That's possible. They lead to peptic ulcer disease. Regardless, he appeared to present acutely to the emergency room with massive stomach pain. So that was a GI, it's an acute abdomen. They called the surgeons, and there's no doubt that he was hypotensive. So he was bleeding internally for how long, we don't know. Typically you cannot bleed internally for long unless it's a trickle bleed. And that's a whole nother thing. So this guy comes in massively hypotensive, and when you're low blood pressure tensive, that's what leads to worsening acute organ failure, especially the kidney. Remember the cardiorenal syndrome, guys. This is for the technicians right here. Cardiorenal syndrome. The heart and the kidney are in bed together. When you're in the ICU, when you work in the ICU, as I did in my training days and even post-residency, when you're in the ICU, it's a life and death place. It's why it's called intensive care unit. You can be sure that the nurses are outstanding there. The team in there is tight, and they're constantly monitoring vital signs: blood pressure, heart rate, cardiac function, renal function, of course, liver function, tightly. Now, this guy's hypotensive. When you come in hypotensive, that's acute renal failure. So on top of chronic renal failure, he had, then he has the bleed, appears. Surgeons come and they open him. They make an assessment beyond the CT scans of the abdomen and all this stuff. And if when they look at the kidney, then this was 1996. Nothing's changed really from this standpoint. They look at the kidney function on acute labs. They see that his kidneys weren't looking good because he's hypotensive, and they don't know where he comes from, what's going on with the guy. They have to be careful with giving him too much contrast dye because it's going to kill his kidneys. So they're going to do a limited workup with a CT scan with no contrast dye. They have to, and they call the surgeons, and the surgeons know what's going on. Surgeons work with someone who is acutely bleeding from a GI bleed. When I was a resident, I'll never forget, GI bleeder. You got medicine on board, that's us, and you got surgeons, that's them. And they're ready to, they have to do an acute surgery. They open up the abdomen and they look for the bleed, to stop the bleed. Now, at that point, he was very hypotensive, he was very sick, he had the multi-system organ failure going on. Apparently, they wanted to transfuse blood right away. Blood transfusion, right away, that's what we do. We assess that. The emergency room doctors right away assess the H&H, and they go for transfusion. He denied it. Check it out, guys. You could read the stuff that I read. He supposedly, the next morning, they worked on him, stabilized him, tried to. The next morning, the next day, he needed blood transfusions or more blood transfusions. I don't know about the details on this, but he supposedly denied the blood transfusions. That obviously leads to multi-system organ failure and severe hypotension, and he died. So there it is for you guys. The moral of the story is, we do know how he died. He died directly from steroids, chronically for years. The moons line up. It takes years and years and years to affect the organs. It's incredible the body that's produced. He was an amazing man. I read more about him politically. Supposedly there was push from the gym owners to make him be the best. He wasn't well paid. He was manipulated, I think, by some people. He seemed to be a really nice person, and down deep, he had such a drive because he felt so poorly about himself, and he had body dysmorphia. And the body dysmorphia is something that starts and develops and worsens the more you see how incredible you can become. Maybe there's the dissatisfaction, and then there's this ability to train harder and do, of course, these incredible agents that transform bodies. So with that said, guys, I hope you appreciate and can enjoy and understand some of the technical aspects of this, because I love to bring it to you as the anabolic doc. But in the end, I want you to really think about what can happen to you when you're doing steroids, because steroids don't kill people overnight, and it's a very slippery slope. And with that, guys, I'd like to hear all your comments and share this video with the whole world, especially young men and women, of course, that are considering getting into this amazing world where there's so much positivity, but in the end, paradoxically, can end up so tragically. Thank you so much, guys.